This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Is joint pain affecting your quality of life? Mercy Health's Dr. Hasan shares insights into the advanced and compassionate care available for joint replacement. With a network of hospitals and physical therapy centers across Greater Cincinnati, expert care is just around the corner.
Hello, my name is Hasan. I'm an orthopedic shoulder surgeon with Mercy Health. We have a team approach, so we have excellent orthopedic surgeons, many of whom are fellowship trained and specialize in joint replacement surgeons. We've got great physical therapists, great staff that help prepare the patient for their journey through shoulder replacement or knee replacement or hip replacement. We also have 6 hospitals spread out all over the Greater Cincinnati area, including the Kings Mill Hospital up in the Mason area, which just opened earlier this year. That means that patients can have their surgeries close to their home, which is easier for them and for their family and support. Surgery is only the last step, if you will, in a journey when a patient comes in with arthritis, whether it's the hip, knee, or shoulder. In terms of how to manage that, oftentimes patients want to try and avoid surgery, and so we will initiate multimodal treatment. These may include gentle medicines to help alleviate pain. They may include physical therapy, both to strengthen the muscles around the joint or to improve flexibility. And sometimes there are injections that are out there that can be considered to help alleviate the pain for a more prolonged period of time. And then we sort of focus on what's called shared decision making. So when patients have tried all these things, and if over time they're getting diminishing return in terms of their response to treatment, then we sit down with our patients and talk to them about the pros and cons of a joint replacement surgery and get them get them prepared for surgery and go through that journey with them. When we choose and we select patients for surgery for the right reasons, often debilitating pain, that pain is almost immediately alleviated in the vast majority of patients. They may have pain from the surgical incision. It's not to say they don't have pain, but patients can tell to us often at the first postoperative visit that the pain that they had before surgery is gone. That arthritic kind of toothache, deep pain that they often just can't resolve is gone. Now, to address incisional pain and sort of perioperative pain, there are a number of strategies that we use. We do what are called nerve blocks or regional anesthesia, and some of the medicines that are injected around the joint are now slow release type medicines that can provide excellent relief for the first couple of days after joint replacement surgery. And when that pain finally comes back, because it's or comes about after the nerve block sort of wears off, because it's a couple of days after surgery, it's very dampened, and so it's very mild. And it's not uncommon for patients to get by with just medicines like Tylenol, for example, instead of painkillers, even though we do prescribe those just in case. We have over 20 physical therapy locations spread out over Greater Cincinnati, which means, again, that patients can have go through surgery and then recover and participate in postoperative rehabilitation close to their home. This is especially true right after surgery when often patients are unable to drive, which means this becomes a little bit of a burden on those closest to them that are going to help them navigate that recovery. And so at each of these locations we have expert physical therapists. We've got excellent equipment, if you will, that can help facilitate the recovery. These include such technologies as zero gravity treadmills, for example, which are easier on the joints right after surgery. And so, again, expert care right in your backyard. In addition, some of our hospitals are designated centers of excellence for joint replacements. For example, a Jewish hospital where I practice, we're a designated center of excellence for hip, knee, and shoulder replacement. That means that every couple of years we are evaluated with a site visit. Our outcomes are evaluated and scrutinized very carefully, and we're even challenged to come up with several initiatives every couple of years to continue to move forward. So we're not resting on our laurels. We're always striving to get better and provide better outcomes and a safer recovery. So I think that what really sets us apart at Mercy Health is providing expert, compassionate, and individualized care for your hip, knee, and shoulder right in your backyard. And this is something that really sets us apart, whether it's going to our physical therapy offices before surgery or seeing one of our many joint replacement surgeons at our various offices, or finally when you cross the threshold to consider joint replacement surgery, to have that done at one of our 6 hospitals close to your home.